Senator Colbeck.
Thank you, Madam President. Well, continuing today's theme of bad legislation for our citizens, let's put up Senate Bill 1019, shall we? This is my no vote explanation. There are many concerning trends in healthcare today. There's a trend in healthcare to replace medical doctors with PAs or RNs. There's a trend to replace RNs with medical assistants or technicians. Patients are consistently being asked to settle for medical professionals with less training than otherwise provided in today's statutes and in today's service standards. A lot of people, and this is most concerning, a lot of people that I've talked to, a lot of seniors in particular, have kind of started accepting that good enough is good enough. I've seen people that I respect highly that are getting up to the age where they say, where they're being told to accept substandard treatment, and they're okay with it because they figure, they just got a few more years left. Let's just free up some resource for somebody else. I never would have thought I'd hear something like that from people as often as I've been hearing it. What the ACA, the Affordable Care Act, also known as Obamacare, has done is essentially dumb down our standards for good quality health care. And I'm sorry, good enough is not good enough. We should demand the best for each and every one of us. When you're sitting on an operating table, when you're sitting there visiting your cardiologist, when you're sitting there with a heart condition, you should be able to have access to the best medical professional available to service you, somebody with the best training that they've had out there as well. So the ACA has already done damage to our healthcare industry by accelerating premium increases. It's eliminated choice. And it's also led to rationing of care for our seniors in the Medicare program in particular. Enough is enough. Now, I have no doubt that CNAs will provide very effective services for most cases. I'm not talking about most cases. I'm talking about the cases where you want to make sure that you have somebody that's seen problems happen and knows how to resolve them quickly. Because keep in mind what a CNA does. They bring a patient near death, and then they revive them again. Every one of us is different. We all have complications. Human body is one of the most complex systems you ever want to go off and try to figure out how it works. I should know as an engineer. We don't know everything that goes on with the human body, but we need to have people that have been trained to deal with as many different circumstances as possible. And the passage of this bill dilutes that ability for most of our patients. Now, this bill, when you're hearing discussions from advocates of this bill, they talk about how rural markets are being pushed out and they need to have somebody to go off and deliver services in that particular community. You always want to have folks available to serve you no matter where you are in our state. And I support the push for making sure we got coverage throughout the state. But the fact of the matter is that the hospitals, and not the hospitals in the rural areas, mind you, but hospitals in general are going to be the primary beneficiaries of this legislation as they replace anesthesiologists with CNAs. And so our so-called nonprofit hospitals actually have a little bit better bottom line because now they can employ lower-cost CNAs. Patients, in other words, the people that we represent as citizens, are the ones who are forced to accept lower and lower standards of care. So if you're concerned about continued decrease in the quality standards in the wake of the passage of this Affordable Care Act, if you're concerned about the continued push for mediocrity or good enough is good enough, and if you want to make sure that our citizens have the best available services with the most training in the personnel that are delivering those services, then I urge you to join me in a no vote on Senate Bill 1019. I'd like my comments added to the Journal, please.
Thank you, Senator Colbeck. Your comments will be printed in the Journal.